The TMJ-TMD conundrum is real and has been puzzling the dental and medical professions for decades. This is the TMJ-TMD Demystified podcast with Dr. Tony Urbanic, where we'll connect the dots between TMD symptoms and the actual cause. We'll tackle common TMD misconceptions and educate you, the practitioner, about a simple, tested, and proven TMD solution that has already provided relief to thousands of patients, while helping practitioners build an additional source of income free from insurance control. Welcome to this episode of the TMJ-TMD Demystified podcast.
Welcome to you, TMD warriors. We are gathered here on a Tuesday morning for the next episode of TMD Demystified. I am Tony Urbanic. Today, the topic of discussion and title is what dentists should know about TMD but don't. What dentists should know about TMD but don't. I've discussed in other places at other times why dentists don't know what they need to know, but we're not going to talk about that today. Some of you have your own opinions about that. Some of you never think about that. But we're going to talk about 9 things that dentists don't know but should know about TMD. And if they do know them, they would have a thorough understanding of the problem and the solution. So let's just get into it. We'll make this episode as A to B as I possibly can. Just one comment prior. The problem with this problem, TMD, TMJ, is that everyone thinks it's complicated, that things that apply to treating them don't work, and that it is a conundrum. All 3 of those concepts are not true. They are not true. So if you know these 9 additional concepts and apply them, you will see how well and easy it is to solve the conundrum. So the first things that dentists don't know is how big this problem is, how huge this problem is. The scientific papers, once read, will tell you that between 15 and 30% of the population, depending on the country, has symptoms of TMD. Well, those papers don't include all of the symptoms. It's larger than 15 to 30%. Actually, it is much closer to 45% of females and a much smaller percentage of males have TMD symptoms. And the reason that I maintain that that percentage is much higher is that the papers, the studies, not bad science, not bad papers, only include the symptoms related to symptoms in and around the jaw joint. But when you include the well-known, well-established, well-accepted symptoms of Meniere's disease, tinnitus, subjective hearing loss, and vertigo, and migraine headaches, which are constantly misdiagnosed, when you add those and additional symptoms of arm, hand, finger tingling and numbness, upper shoulder pain and tightness, and a few others that are still under investigation, but seemingly fairly common. A good example that I can talk about is patients' complaints of sinus pain. They complain of sinus pain, which is misdiagnosed as sinus problems all the time, when actually the originator of the symptoms is temporomandibular joint disease. So when you add all these up, you really end up with 45% of the female population, much less in the male population, who have significant TMD symptoms. Now, not all patients have significant symptoms enough where it ruins their life or they have constant attention on it, but a huge number do. So first thing that needs to be acknowledged is how big the problem is. The prevalence of TMD is huge in our society. Now, second thing about that is a spinoff off that, as a spinoff off that is if you do that number, 1/4 of a dental practice's patients has TMD symptoms. And most of those symptoms are ignored by the practitioner, by the dentist or hygienist and the staff. Most of those patients are not aware that their symptoms that are bothering them are coming from the temporomandibular joint. As I've talked about many times, there isn't anybody else who can treat those symptoms adequately other than a dental practitioner. So they're in the right place. They just are not, the patient is not aware enough, and the dentist is not aware enough, is to ask the right questions to make the symptoms obvious, and then to go on with treatment if so desired by both practitioner and dentist. Second thing that is not known by the dentist but needs to be known by the dentist is that all of these symptoms are directly caused by inflammation within the temporomandibular joint. Now, I've spoken many times about why that is, how that came to be understood correctly. But if you talk to 100 dentists, 99 of them or more out of 100 are not going to understand. They don't know that the simplicity of it is that all of the symptoms of temporomandibular joint disorder, and it is only one disorder because it's caused by only one thing. It is not disorders. You have multiple symptoms, but the symptoms are not disorders. The symptoms are symptoms. Big confusion about that. As an aside, you hear a lot of important people talking about temporomandibular joint disorders. Well, there's a lot of symptoms, but it's only one disorder, which is my point here, because it's all, the disorder is inflammation within the temporomandibular joint. With or without joint bony damage, with or without meniscus damage, with or without meniscus dislocation, you can have a lot of inflammation in the joint without any observable changes on X-ray. So it is all about inflammation in the joint, and the dentists don't know that. And we'll carry on that a little bit, why that's extremely important. Obviously, because if you can handle, decrease, mitigate inflammation within the temporomandibular joint, then one would expect the symptoms to go away. The third point is that they don't know the complete list of symptoms. Again, they think just, well, noise is, if it's making noise, it's a symptom. Well, no, actually noise is a sign, not a symptom. A symptom is something, let's just say a consequence of a disease that is unwanted. That is a symptom. A sign is more aligned to a sign like an eye sign. If you have problems following a finger in front of your eye, well, that's a sign. That's an ocular sign. That's not a symptom. So clicking of the temporomandibular joint is a sign, not a symptom. But the point is, all the symptoms are well known, well designated. I've already commented on a couple of them, but I'm going to reel them off again. The symptoms established, agreed upon, of TMD, TMJ are frequent or recurring, or frequent and recurring, if you wish, headaches, earaches, jaw pain, neck pain, ringing in the ears, subjective hearing loss, fullness in the ears, dizziness, vertigo, upper back and shoulder pain and tightness, arm, hand, finger tingling and numbness, and various types of locking associated with the temporomandibular joint. Those are the well-established symptoms, and the majority of dentists may know 2 or 3 of those, but they do not know the rest of them. So it's very important that you know actually what the symptoms are. The next thing that dentists don't know but should know is how easy this is to treat. This is not a complicated problem to treat. Once you get past the fixed idea that the problem, first of all, is complicated, again, just understanding inflammation in the joint is the starting point. That's not a complicated concept. And once you understand that if you treat the inflammation in the joint, the symptoms will go down, then you know that the problem is easy, first of all, to diagnose. How do you diagnose temporomandibular joint? Well, here it is in a nutshell. You list the symptoms. Those are red flags. You don't make a diagnosis on symptoms, but you have a list of symptoms that makes you wonder, differential diagnosis, could this be TMD? And then you open the joint and push with your fingers and have the patient bite down rapidly once. And if it hurts, the joint's inflamed. If it doesn't hurt, the joint isn't inflamed, but you have to make sure that you do it properly. Open widely, put your fingers into the glenoid fossa after the condyle comes out of the glenoid fossa, push firmly, and then have the patient bite rapidly once. If it hurts, the joint's inflamed. Just similar to pushing on a bad knee. If you put pressure on a bad knee, you put pressure on that inflammation, it will cause pain. Fifth thing that a dentist doesn't know but should know is how easy it is to treat. And I inferred that as I discussed inflammation. And it isn't hard to treat inflammation. Of course, we all know nonsteroidals treat inflammation very well, very successfully for a short period of time. Patient on anti-inflammatories will be effective in treating inflammation for a week or 2, and then the nonsteroidal anti-inflammatory runs out of steam. It is no longer effective on decreasing the inflammation, but certainly can cause gastritis and stomach pain if you use it enough, and worse if you use it constantly, liver and bladder and liver and kidney damage. So it is understood that it is very easy to diagnose and treat. Number 6, dentists don't know how treating TMD can grow their practice. Very simple concept. Treating TMD using our device, protocol, and method will take an average practitioner, start to finish, consultation, device delivery, and follow-up, on average, no more than 45 minutes start to finish, including your consultation. So when you treat a patient start to finish and you get results where they say 85, 90, 95, 100% of their symptoms are gone, you are their friend forever, and they will refer you patients, their family, their friends. They'll talk about it. And even more importantly, a great number of them will look at you and want you to be their dentist, their dental practitioner, because they trust you. They know you know what you're doing, and you have made a friend forever, and it will grow your practice along with the patients that they refer in. How do I know that? Because we see that all the time here in our practice and the other practices that use the Urbanic device and protocol. Number 7, dentists don't know that treating TMD can open a whole new referral source category. Now, this takes a little bit of extra discussion, but again, it's very, very simple. We found out that one of the major stops and barriers to treating TMD and getting the patients to understand that they have TMD and not some other problem is enlightening, making the physicians and physician types aware of TMD itself, what the symptoms are, and how to diagnose it. So we have actually figured out how to market to make aware. Marketing equals awareness, making physicians, PCPs, ENTs, neurologists, nurse practitioners, physician's assistants, NPs and PAs that work in convenient care clinics, even chiropractors, physical therapists, make them aware, because they all see their portion of patients with headaches, shoulder pain, neck pain, earaches, ringing fullness, dizziness that they constantly misdiagnose. Once they are aware, through a very simple marketing program, sending out snail mail letters to each of the prior doctors who saw that patient, at each time the patient shows up for a consultation, delivery, or check, and what the symptoms are and how many of the symptoms are decreased at any point in time, they will very rapidly understand what the symptoms are. They will very quickly understand that they misdiagnosed it, and very quickly know where, once diagnosed, they should send a patient with TMD. And using that system that I briefly outlined, that is why our particular practice has 800, as of this date, 837 referral sources, most of them from physician types, not dental types, although we get a huge number from dental practices. Also, being an oral maxillofacial surgeon, I'm not in competition with general dentists. I am in competition with my oral maxillofacial surgery colleagues, and I get a lot of referrals from them for non-surgical TMD treatment. So the sixth thing that they don't know is that it can grow your practice, and it really can. The seventh thing that dentists don't know is that, the eighth thing, covered that one. The eighth thing that dentists don't know is that treating TMD can add hundreds of thousands of dollars to their bottom line, and that is a fact. We have doctors now in our network who use the Urbanic device and protocol. Simple. All you're doing is unloading the joint adequately to decrease the inflammation, which decreases the symptoms. Protocol being 24/7 for 2 months, and then nighttime the rest of your life. But our network providers who do that, we have several who are adding hundreds of thousands of dollars per year to their bottom line, which is certainly an advantage to any doctor who gets involved. So in summary, what doctors don't know is that unloading the temporomandibular joint adequately over a period of time by disoccluding the posterior teeth, watching the process carefully, you have to observe the patient, solves the TMD conundrum. So we started out today defining the conundrum itself, what it is, the misunderstandings about the problem, the fact that TMD is not a list of disorders. It is one disorder, inflammation within the temporomandibular joint, caused by, what is inflammation in the joint caused by? It is caused by bruxism, it is caused by acute trauma, leading to chronic inflammation, and is caused by functional malocclusion, leading to chronic inflammation. And of course, bruxism leads to chronic inflammation. So the common denominator is chronic inflammation within the temporomandibular joint, which decreases fairly rapidly once you unload a joint and keep it unloaded according to a very simple protocol. That's what we call the Urbanic device and protocol. If you would like to learn more of the specifics, those were the generalities about how to use it, how to get involved, how to join the network of doctors, growing network of doctors, both independent and DSO doctors throughout the United States and beyond, who treat their patients with the same method. More information can be seen at www.urbanictmj.com. I can be reached at tony@tmjservices.net. Our Director of Marketing, Dr. Naomi Williams, can be reached at naomi@tmjservices.net. If you have any questions or criticisms, questions for sure, criticisms for sure. Interesting feature about all of the episodes that I record is that after almost 2 years now, I have not had not a single person offer any criticism about any particular statement that I've offered, that I've said on these episodes. And I know a lot of what I say is controversial. That's accepted. I agree that it's controversial, because starting out with myofascial pain dysfunction syndrome and everybody buying into that it's a muscular problem, which it's not. It's not a muscular problem. It's an inflammatory problem within the temporomandibular joint itself. So I haven't got any criticism at all. So I encourage, if you'd like to criticize, just, I'm okay with it. We can discuss it. I'm willing to listen to your point of view. All I give is facts, facts that can be looked at in the literature, that has been in the literature for 50, 60, some of it 70 years, science. So if you like to comment, criticism, I can be reached, tony@tmjservices.net. For today, that's adequate. I look forward to the next time we can speak. I hope I have an interesting topic lined up for you at that time. I am Tony Urbaniak, and this is TMD Demystified.